Has this whole situation made you reconsider doing medicine as well?
Well, I don't know. It hasn't made me reconsider because I think even from the get go, not the get go, let's say second year, I was a bit like, oh, I don't know if this medicine thing is for me, to be honest. But I've always known to be not known, but let's say beginning of this year, like this academic year that is, so like September, I kind of already knew that so medicine split into like surgery and medicine, by the way. So when I say
Okay.
medicine, I kind of like your cardio, so like your heart, your lungs, kidneys, all that kind of stuff. And when I say surgery, I mean more like what, operating surgery. But I think from the start of this academic year, I always kind of knew that, okay, I'm probably not going to be in medicine. So I'm not going to be doing your kind of like lungs, respiratory, cardio, like heart kind of stuff. I'll probably be more in your like your surgery side, not necessarily operating, but like doing the surgical like specialty. So because of that, I think my decision hasn't really changed because of the whole COVID thing. Because COVID thing, let's say, and most pandemics like and all infectious diseases, they're more in the medicine side. They're not really in the surgery side. So it hasn't really changed my view.
So coming back from technical difficulties, I was asking like how the same way we have like final year meds who are helping volunteer and stuff in the NHS. I assume it'd be the same for surgeons in that as well.
Okay, so from what I know, so this is from because I just finished my orthopedics and trauma placement before they sent us home, and one of the consultants who was teaching us, he's a surgeon, hip and knee surgeon. He was basically saying that all they're going to be doing is basically just assisting because most surgery like kind of SHOs, registrars, consultants, whatever. It's like from what he's saying. Okay, so take everything that I say with a pinch of salt. That you're really out of it because the thing with medicine, it's a constant learning, it's a constant revision. And not in terms of like sitting down and revising and going over what you're taught, but because you're in on the ward, you're literally going over things over and over again. So for them, and you have to think about it as well. These consultants in respiratory, which is where most of the COVID stuff is happening because it is a lung pathology. Most of the like the workers in the respiratory area, they've been doing respiratory for years, just like, think about you finish your foundation placement, which is 2 years, then you start your core training, which is like, I don't know, it varies from like 3 to 8 years. And then you go on to do registrar and it can take up to like 8+ years to do registrar. And then you're looking for consultant positioning. So you've got years of backing on you. So for the surgeons in like surgery to then like move into respiratory, it's not possible and it's unsafe practically, like frankly. So the main thing that I think especially like maybe medicine can kind of help us. The main thing that surgical um, doctors will be doing is kind of just assisting, if that makes sense. Don't ask me what I mean by assisting, but I guess just like checking obs, or just basically, I don't know, being the run around man for the respiratory the respiratory like consultants or SHOs or something like that. But yeah, if that answers your question.
Yeah, that makes sense. I suppose when you say it like that, it's almost like surgeons are like you might as well just be a regular person when it comes to switching to raspberries like that.
Raspberries.
I'm giving up with pronunciations today.
Oh,
But no, I get that.
yeah. It's just because like each specialty is so detailed and like they all have their individual exams. Like you just can't really expect like like for example all these TV shows are so nonsense, especially like The Good Doctor. Like you can't expect one doctor to be able to do an aortic dissection, or aortic rupture repair, then be able to also do a limb repair, and then also be able to do brain surgery. Like it's absolutely nonsense. Like it's not possible. So the most other doctors can do who mostly do elective surgery. So for example, things like cataract surgery will be postponed. So those doctors instead will then be able to help, I don't know, with assisting in respiratory or wherever else needs help. That's it. It's not like they're going to all of a sudden become respiratory doctors because they can't. They don't have enough. I mean, they don't have the in-depth knowledge as much as like the other respiratory doctors do. All they can really do is just assist the best they can. But again, take what I'm saying with a pinch of salt. I'm not a doctor.
Yeah. Okay, that's interesting. I guess I could ask, like, would this not make you consider private versus public a bit more? Or is it
So
still completely the same?
I frankly want it to go private, but for different reasons, not necessarily because of the whole pandemic stuff. But I want private care for different reasons.
Is it much different in terms of the quality of doctors and surgeons and stuff? Because I assume it's more or less no waiting time as opposed to better doctors.
Yeah, so frankly, the doctors that you're going to get in private care, the same doctors that are going to be in NHS. The main difference is you're correct. It's like waiting time, and also because the NHS is state funded, to get a lot of procedures, you need to meet certain like criteria. So, for example, people who suffer from like fibromyalgia or like rheumatoid arthritis, in order to get like kind of high end, not high end, but like kind of like the how do I say it without it sounding weird? Like the top tier or like the kind of like new drugs that are really expensive, so the NHS can't readily fund it. In order for them to get their hands on those drugs, the patients that is, they need to meet certain criteria, and only then can they get it. Whereas if you were in private care, because you are paying for this, you can easily get the drug, or do you get it? Or like, or let's say something like if you got fibroids, like it's basically masses that grow on in the female's womb, uterus. I'm trying to use lay terms, but yeah, like if you've got those kind of things, the NHS, like frankly, unless they cause pain or unless they're really hindering you in some sort of way, then you can get put on a waiting list, which is like so long to hopefully get surgery to remove them, for example. But that whole process can take ages. Like even for you to just get put on the waiting list can take like a good 6 months just to get that all sorted out. Because then you have to think about, you go to GP, how long does it take you to get a GP appointment? You go to GP, how long does it take the GP to refer you for a scan? And then you go to the scan. How long does it take for the scan results to even get interpreted? How long does it take for the interpreted scan results to get relayed back to your GP? How long does it take for you to then get an appointment with your GP? How long does it take for you for your GP then to refer it again back to the right specialty to look for stuff? Like, do you get the gist? So that
Yeah.
can take ages. Whereas if you're in private care, you can get your scan done within days, possibly even the same day. Then you can do your preoperative check to make sure that you're fit for surgery and get the surgery done within weeks. So that's kind of like the difference between it. It's the same care, or it should be the same care, quotation mark, by the same doctors.